What do I do if my ferritin level is low? And we see that a lot, right? Normal ferritin, like we were saying for men, is from 30 to 400 for most. Some are 15 to 360, but it's a very wide range. And as I told you, right now, optimal, we'd like ferritin to be about 40 to 100, in the mid 50s or so. What happens if your ferritin goes below this? Low ferritin is as bad, if not worse, than high ferritin and high iron. Because as we said, we need iron for life. So sometimes you'll see patients come in, they have a normal hemoglobin, but their ferritin is low. In one of your questions, this reader said his ferritin was down to 2. That's very low. So you can have a low ferritin and your hemoglobin did not change yet, because that's the first thing that we see, the ferritin goes down. And ferritin is pretty sensitive for iron stores when it's low. When ferritin is high, there's different reasons, but when it's low, it usually will reflect a low iron status. So when I see a patient with low ferritin, the first thing we got to ask, why do you have low ferritin? And there's only a few things that can cause low ferritin. You're losing blood somehow, some way, or you're not absorbing enough iron. So when I see a low ferritin, I ask, why is this happening? Is the patient donating blood? And if you donate blood within the first 6 to 8 weeks, if you check your labs, your iron indices are going to be on the lower side because your body did not remake all the iron that it needs after donating blood. If you're over donating, so you donate too much, yeah, you can have a negative balance. And that's what we tend to see a lot with guys on testosterone, because they hear donate blood if you take testosterone, because testosterone can induce secondary erythropoiesis. So you see an increase in hemoglobin and hematocrit. But you can't donate blood blindly. And following the hemoglobin is not good enough. You need to follow the ferritin. So the situation I found a lot of my patients, and that's why I started checking iron, is they donate too much and they drop their ferritin. And when you drop your ferritin, you have a lot of the same symptoms you could get with high iron. So low iron levels cause a lot of anxiety, depression. Even it's been associated with ADHD. You feel tired, low energy, shorter breath. You can exert yourself. You have reflexes. So sometimes your arm moves. You start wanting to eat non-food items. People want to eat ice. They want to eat chalk. It's bad for your heart. It's bad for your brain. So low iron is bad. But having a low ferritin, you need to know why. So number one would be, are you donating blood too much? If you're not donating, we need to look for another thing. The number two would be that you're losing blood in the GI system. Chronic gastritis, if you're taking medication like anti-inflammatory medication like ibuprofen or Advil, low-dose aspirin causes microbleeding. And if you're 40 or more and are any age, and you see that you have a low iron, and if you can't find a reason for it, you need a GI workup. I've had many patients who came to me with low iron. When they went and did a colonoscopy, endoscopy, either they find chronic gastritis or more commonly, they'll find polyps in their colon. And polyps start bleeding microscopically and eventually can form into colon cancer. So if somebody has low ferritin, you need to know why. It's not just, let me take iron. So my first question is, let's find out why. And there's a differential diagnosis. If it is bleeding, that you're bleeding, if there's chronic gastritis, they can laser it. If you have a polyp, they take it out. If you are donating blood too much, you stop donating. If another reason that I saw, it's poor absorption of iron. So something like, and I've diagnosed maybe 3 people with this, celiac disease. When you have celiac disease, you have blunting of the cells of the small intestine and more difficult to absorb different elements, different minerals. Iron is one of them. So I've found some patients with iron deficiency. When we went down the list, their cause of iron deficiency was celiac disease. So for people to kind of think, again, don't just say I have low ferritin, let me take iron. First question we need to answer, why do you have low ferritin? Do we need more testing? Now, once we've established the cause, you try to stop the cause. If you're donating blood too much, stop donating until your ferritin goes up. If you have bleeding somewhere, deal with it. But if at the end of the day, we found, okay, you were over donating, let's say, you stop donating, how do you increase your ferritin level is always the big question. And there's different ways of doing this. For sure, if you have a low ferritin, you want to go on iron replacement short term until you get your ferritin, like this guy who had 2, I want him in the 30, 50, 60 range, right? So you take different ways. You can increase your dietary intake of iron. eating more iron-rich foods like, and you want to eat mostly foods that have heme iron, because heme versus non-heme iron has better absorption. And that's what you'll find in animal products like red meat, shellfish, poultry, pork. Non-heme iron, you will get that from vegetables like beans, spinach. It has a lower absorption. So you want to really do a lot of heme iron, combine that with vitamin C. So if you want to absorb your iron, you make sure that your meat, you put some lemon juice on it. So that helps with the absorption. And if you need now supplements, because a lot of times that may not be enough to do just by diet, which iron supplements should you take? So I'm not going to give like a brand per se, but for example, iron sulfate, FeSO4 is what we usually recommend more. The absorption is not great. I like more heme iron supplements, meaning that they come from an animal source. They have much better absorption. So if you're going to take an iron form, it has to be a heme iron. And here's something that is very important. You cannot take iron tablets daily, every day. It's better to skip it, because I'm going to speak about a protein that we talked about the last time, and we're going to spend a lot of time talking about this, hepcidin. Yeah. So hepcidin, it is the main regulator of iron physiology. Hepcidin was only discovered in 2001, only 23 years ago. So I found out about hepcidin last year. Most people haven't heard about that molecule and the physiology because it's pretty new. And there's no commercially available test to check your hepcidin level, but it makes sense, the physiology. So now let me go a little bit about the physiology of iron. The way we get iron into our body is we get it from two sources, either from dietary intake, what we eat, and that's usually about 2 to 5% of the iron that's in our blood we get from our diet, pretty small. Most of the rest of the iron comes from the recycling endothelial system, RES, that gets into the spleen. So when our old red cells die, they go to the spleen, they get destroyed by the macrophages, and the macrophages keep that iron. So hepcidin also regulates the recycling of iron. That accounts for 90 to 98% of the iron in our blood, meaning that when the red cells get destroyed, they keep the iron. Depending on the hepcidin, it will decide whether they keep the iron in the spleen or release it into the blood to go for new red cells. So hepcidin is in the middle of this. It's secreted by the liver. And in the case of normal or high iron stores, you have a high level of hepcidin. And what hepcidin does, it goes and blocks the absorption of iron in the intestine, and it also blocks the release of iron from the macrophages. So just picture that is the way we get iron into us. You have two lines coming in, one from the intestine, one from the macrophages from the spleen. Hepcidin blocks both of those. So you have high iron stores, those two lines are blocked, your iron stores stay the same. Although you're eating iron, your body's not absorbing it. If you have low iron stores, your hepcidin levels goes down, remove the block from those lines, now you absorb iron and you put iron from the spleen into the blood test. So hepcidin is the controller of those lines. It either turns it off or it turns it in. When you take iron supplements, the body has very tight mechanisms to control iron, because it knows, the human body is smart. It knows that we need iron, but too much is bad. So get just enough. When you take iron tablets, it raises your hepcidin, and it makes sense, right? The body, you take iron, usually we don't take that much. So iron, you can take from 15 milligram up to 200 milligram tablet. So when you get a dose like the body's like, oh, we have enough iron. Block the channels. And you block the hepcidin level, stays elevated for 12 to 24 hours. So I used to recommend, from my conventional training, iron sulfate twice a day. The one you take in the afternoon, you're barely absorbing anything of it because you have high hepcidin at the moment. Yeah. The lines are blocked. So if you're going to take iron, it's recommended to skip a day. Take it every 48 hours, every 72 hours. Because by the time you take your next dose, 48 or 72 hours later, your hepcidin level went down, the lines are open, so your body will absorb more of it.
Great.
So another thing that's really important, and a lot of my patients, I don't even put them, if it's not too low, you don't even put them on iron supplements. I like desiccated liver supplements. So liver is the most important reservoir of iron in the body. That's why if you look at every apex predator, when they make a kill, they go straight for the liver. They know that's where they get the iron, the copper, the magnesium, the vitamin A, all of those good supplements, minerals, and vitamins that you need. So taking desiccated liver, extract of liver from a good source, you want to be sure that those are grass-fed, no pesticides, no growth hormone, bovine growth hormone. You want the cleanest source possible, because in a lot of cases, you get some iron, but you get what's most important in iron physiology is copper. Copper as a mineral completely controls iron balance. So a lot of times you can have people who have either low iron or another form of anemia called the anemia of chronic disease, where your iron is not low, it's just unavailable to you. When you have this, you take just copper, the right amount of copper, and you can liberate your own sources of iron. So very important. So low iron, I think we've established, although we're going to talk after that about iron overload, but low iron, low ferritin is as dangerous, if not more dangerous. Actually, iron deficiency anemia is one of the most common nutritional deficiencies in the world. It affects mostly women who have their period, women after pregnancy, and young kids, young children who may not have the right nutritional supplements, nutritional intake of iron. So it is really important.